Hi everyone, welcome back to my YouTube channel. So today we are going to talk about the topographical and anatomical structures of the peritoneal cavity and the extraperitoneal fat spaces and fascia, and also the communications between the topographical structures of the peritoneal cavity. So I have already drawn the basic diagram of the peritoneal cavity. Here is it. So this is the view if a person like this. So we are cutting the person we are cutting in this plane, okay, cutting in this plane and looking from this side, this lateral side, okay, that is the vertical cross section, and this is the lateral view of it, okay. And here uh, this is the posterior, this is the anterior, superior, inferior. So here this is the back side and this is the spinal cord, and here this is the anterior abdominal wall and diaphragm here superiorly, and here this is inferiorly the perineal floor, pelvic organs, okay, liver, stomach, transverse colon, intestine, small intestine, sigmoid colon, okay. So here you can see an orange color lining, right? That is the parietal peritoneum. Parietal peritoneum means the lining of the abdominal wall from inside lining of the abdominal wall. And here you can see a yellow color lining also. So that is the visceral peritoneum. Visceral peritoneum means the lining of the viscera. Viscera means actually basically those are the internal abdominal organs, okay. So lining of the organs. So here according to the linings, these organs we are dividing into three categories as intraperitoneal, mesoperitoneal and extraperitoneal, okay. So intraperitoneal organs means those organs are covered by the peritoneum fully, okay. So those organs are stomach and transverse colon we can take as examples. That means those organs are fully covered by the peritoneum, okay. And mesoperitoneum means those organs are only covered by from the three walls, okay, three walls of the organs only covered by the peritoneum. As examples, liver, the uterus, okay, those are mesoperitoneal organs. And extraperitoneal means those organs are not covered by the peritoneum, or otherwise only one wall of the organ has covered by the peritoneum. So examples, pancreas, duodenum and kidney we can take as examples. So you can see here the orange line, right? That is the parietal peritoneum. So these organs are behind the parietal peritoneum. So you can see these are not touching some otherwise can be touched only one wall. So you can see that is extraperitoneal organ, that is extraperitoneal organs. These all are extraperitoneal organs, okay. So here this is the aorta, okay, and then here this is the small intestine as I told before, the cross section of the lobes. So here the upper lobes are for jejunum and below lobes are for belongs to ileum, okay. And here this is the sigmoid colon, okay. And here you can see the liver, and up the above the liver you can see two triangular ligaments and the coronary ligament of the liver. Here you can see a greenish color structure, right? That is the lesser omentum, also we call as the omental bursa, okay. So I will just tell you the borders later. Also I'm going to tell when I am talking about the topographical structures. Here the anterior, the lesser omentum. Lesser omentum means a ligamental structure which has made by the hepatogastric ligament and the hepatoduodenal ligament. And here this is the inferior wall. This is the great omentum. That means the transverse mesocolon. This is the transverse colon, stomach, okay. And here the posterior wall, that is the posterior abdominal wall. Superiorly it's the diaphragm. The superior most one is the diaphragm, but we can say also about the caudate lobe of the liver, but the best answer is the diaphragm. And right lateral is the epiploic foramen. Epiploic foramen we also call it as Winslowy foramen. And left lateral there should be spleen here, so spleen is the left lateral border of the lesser sac or mental bursa. So here this the big space we call as greater sac, okay, greater sac. This in between this greater sac and the lesser sac, it's communicating from the throughout the epiploic foramen, this way or this way, okay, throughout the epiploic foramen, okay. And here you can see the urinary bladder, uterus and the anal canal, right? The parietal peritoneum is there, and then you can see two pouches are there. This pouch we call as rectouterine pouch, and this pouch we call as vesicouterine pouch. This is a female peritoneum because uterus is there. So these two pouches we also can tell as Douglas pouches. Okay, if a male, then we can say like this. Okay, if a male, we can say this is the bladder, this is the anal canal. So parietal peritoneum is there, one pouch is there, that is rectovesical pouch, or otherwise we can say it as Douglas pouch. Now we will talk about the epiploic foramen, the topographical structure of the epiploic foramen. Here is it. Okay, we can compare with both, right? Compare the both. So here, this is the epiploic foramen, superiorly the caudate lobe of the liver. You can see it, epiploic foramen, superiorly the caudate lobe of the liver. Okay, and in anteriorly, it's the, here you can see it's the lesser omentum. So this is the free margin of the lesser omentum. It contains this bile duct, portal vein, and hepatic artery. This area. Okay, this is it. So this is the anterior border of the epiploic foramen, anterior border. And posteriorly the pancreas and inferior vena cava should be deeply inside there, so that those structures are the posterior walls of the epiploic foramen. Inferiorly, that's the first part of the duodenum, so here the duodenum, it will go like this, so it will be the inferior wall of the epiploic foramen. Okay, so now we will talk about the extraperitoneal fascia and the fat spaces. Here this is the posterior side. Okay, posterior. Here this is the skin and this is the vertebra, you can see. So this is the posterior side. So outermost layer is the skin, this one, skin. Okay, and then next it is the endoabdominal fascia, also we call it as transversalis fascia. Okay, transversalis fascia. In between these two layers there should be subcutaneous fat, superficial and deep fascia, and also the muscles, but I have not mentioned it in this picture, but I will show it in the next picture. Okay, so here after the endoabdominal fascia, you can see here two fascial layers. I think it will be better to tell the relationship between the kidney, and then you can understand. So these are the two kidneys, okay, cross sections of the two kidneys, and posterior to the kidney, so these are the posterior renal fascia, posterior to the kidney, posterior renal fascia, both fascias. Here anterior to the kidney, anterior renal fascias, anterior renal fascia. Okay, this is the ureter cross sections, and here this is the pars major muscles, okay, and here this is the parietal peritoneum, this also anterior renal fascia, these two, and here you can see, you know that ascending colon and descending colon is there, and besides of the ascending and descending colons, the lateral to those colons, there are two topographical structures we call as lateral canals, right and left. So those lateral canals I will explain in later. So those lateral canals are lining by the lateral canal fascia, these two, lateral canal fascia. Okay, lateral canal fascia are the fascia extensions of one of the anterior renal fascia and the one of posterior renal fascia. Okay, so here now we will talk about the fat spaces, and here you can see in between the endoabdominal fascia and the posterior renal fascia there is a fat space we call as posterior pararenal space, also we call as proper retroperitoneal fat space. Okay, this in between the endoabdominal fascia and the posterior renal fascia. In between two posterior renal fascias, there is a fat space called retrorenal fat space. Okay, and around the kidney we call this fat space as perinephric fat space, and around the ureters we call this fat space as paranureteric fat spaces. Okay, and here this plane we call as retromesenteric plane. Here when the posterior pararenal fat space extend into the lateral, so we call this fat space as, in the lateral aspect, we call as lateral extraperitoneal fat. Okay, So, and here is ascending colon, descending colon, pancreas and the duodenum, infravena cava and the aorta. So that is the horizontal view. Actually, this is the, if the person is like this, so we are cutting in horizontal plane and looking below, okay, looking below. That is why we can see the ascending colon in this side and descending colon this side, because we are looking from downward, from the below, from below, okay, not from the upward. If we are looking from the upward, these structures should be changed, the left and right should be changed, but this is the below view, okay. So now we will talk about the vertical view, okay, vertical view. So the same structure, the horizontal view is here and vertical view is here. So I told you before this, in between these some structures I didn't mention, but here I mentioned those. So this is the outermost layer skin and this is the innermost layer parietal peritoneum. So here you can see in between the endo-abdominal fascia and the skin there are some structures. Subcutaneous fat, this is the superficial layer of the superficial fascia. This is the deep layer of the superficial fascia, muscle layers and endo-abdominal fascia. So these structures are should be here also. Here there should be these structures, okay. So now I will explain the structure. So here you can see, as I told before, skin, then subcutaneous fascia, superficial layer of the superficial fascia, deep layer of the superficial fascia, muscles, endo-abdominal fascia. We also call it as transversalis fascia, endo-abdominal fascia, transversalis fascia, the same. And then here, in between the endo-abdominal fascia and one of the posterior renal fascia, I told before also, that is proper retroperitoneal fat, para renal fat space, okay. And in between the posterior renal two fascias, we call the fat space as retrorenal fat space. And here this is the kidney and the ureter. Around the kidney, that is the perinephric fat, and here this is the paraureteric fat space. This in front of the kidney, that is anterior renal fascia, two fascias. Okay, this is colon. So around the colon fascia, fat we call as pericolic fat. Peri means around, colic means colon, the pericolic fat. This is pericolic fat, and here is the colon. This can be ascending or descending, okay, descending colon or ascending colon. And parietal peritoneum is innermost layer, okay. So that's the vertical structure. Now we will discuss about the topographical structures, okay, topographical structures and the communications in between the topographical structures. So here the peritoneal cavity we can divide into two parts according to the transverse colon. This is the transverse colon. Above the transverse colon, we are taking the transverse colon as a margin, and we are taking the above transverse colon, we say it as supracolic compartment, and below the transverse colon we call as infracolic compartment, okay, in supracolic, infracolic, okay. And then here now we will discuss about the supracolic compartment before at first. So the first structure we will tell about the omental bursa. Actually we discussed that before, right? I will just remind you. Omental bursa, lesser sac, okay, anterior wall is lesser omentum, posterior wall is posterior abdominal wall, superior is diaphragm, also can call about the caudate lobe of the liver, but best answer is the diaphragm. Inferiorly the greater omentum, left lateral is spleen and also its ligament should be there, and right lateral is the epiploic foramen, also we call as Winslowy foramen, right. Greater sac, which we call as omental bursa, is communicating with the greater sac with the epiploic throughout the epiploic foramen. Then the next structure is the right hepatic bursa. What is right hepatic bursa means? It's here, this structure, this topographical space, right. So right hepatic bursa also we call as right subphrenic space, okay. Subphrenic means, sub means below and phrenic means diaphragm, so below the space below the diaphragm, okay. So here in right side, okay. Then so this space, the superior border, You can see it's diaphragm, and inferiorly it's the right lobe of the liver, right? And posteriorly, actually there are two triangular ligaments in each sides of the liver, right and left. Triangular ligaments are there. In between those triangular ligaments, those triangular ligaments are connecting by the coronary ligament of the liver, and there is another ligament we call as falciform ligament. This is it is in between the right and left lobes of the liver. Okay, so posterior wall of the right hepatic bursa is right triangular ligament and the coronary ligament. Okay, and inferior lobe is, I told you, right lobe of the liver, and left border is the falciform ligament, and anterior abdominal wall will be here. So the parietal peritoneum of the anterior abdominal wall. Okay, I am taking my hand as the anterior abdominal wall. So the inside lining is the parietal peritoneum. That will be the anterior wall of the uh, right hepatic bursa. Okay, right hepatic bursa. So that is the right hepatic bursa, also we call as right subphrenic space. And then next we will take the left hepatic bursa. Okay, left hepatic bursa. Okay, you can see the border lines here. Okay, so left hepatic bursa is here. So the superior wall same as before, the diaphragm, and inferior wall is the left lobe of the liver, posterior the left triangular ligament and the coronary ligament, and right side it's the falciform ligament, as same as before. The anterior wall is and parietal peritoneum of the anterior abdominal wall. Okay, and then next we will talk about the pregastric bursa. Okay, pregastric bursa. What is pregastric bursa means? It's here, okay, superiorly it's the left lobe of the liver and the diaphragm, superiorly. Inferiorly it's the transverse colon, anteriorly the parietal peritoneum of the anterior abdominal wall, right? Then posteriorly lesser omentum and the anterior wall of the stomach, lesser omentum and the anterior wall of the stomach. Lesser omentum means the hepatogastric ligament and the hepatoduodenal ligament. Okay, so this is the pregastric bursa and this is the left hepatic bursa. So these both together we call as left subphrenic space, okay. So left hepatic bursa and the pregastric bursa are communicating together, right? Okay. So then the last one of the supracolic compartment is the subhepatic bursa. If the liver is like this, here this side will be the inside, okay, this inner surface will be the visceral surface, okay, so inferior margin of the visceral surface of the liver is the superior border of the subhepatic space. Subhepatic means below the liver, okay, and then inferior margin of the subhepatic space is transverse colon and its mesocolon. Will be here. Okay, so this is the subhepatic space. Now we will go to the infracolic compartment. There are 4 topographical structures. We call those as paracolic gutters. So there are 2 lateral canals and 2 mesenterial sinuses. Okay, so this is the ascending colon, this is the descending colon, this is the right lateral abdominal wall, this is the left lateral abdominal wall. So parietal peritoneum will be lining this right lateral abdominal wall and the left lateral abdominal wall. So in between the parietal peritoneum of right lateral abdominal wall and ascending colon, this is the right lateral canal. So here in between the parietal peritoneum of the left lateral abdominal wall and the descending colon, it's the left lateral canal. So in between the ascending colon and here this is the mesocolon of the intestine, small intestines, okay, and this is the root of the small intestine, mesocolon. So here in between this and the ascending colon, this is the right mesenterial sinus. Between this and the descending colon, it's the left mesenterial sinus. Okay, so Here now we will talk about the communications. Okay, here you can see right lateral canal I have drawn already. I will draw the other structures now. So you can see here uh, right lateral canal is communicating with the right hepatic bursa and the subhepatic space, right? I have mentioned here, right? Here, but you can see there is a ligament called phrenicocholic ligament. Phrenicocholic ligament. Because of this ligament, left lateral canal can't communicate with the supracholic compartment. Okay, can't communicate with the supracholic compartment. Here, right lateral canal can communicate with the supracholic compartment. But here you can see because of the cecum, it's obstructing the way to the pelvic cavity to the right lateral canal. So it's not communicating with the pelvic cavity, but it's communicating with the right hepatic bursa, that means right subphrenic space, and the subhepatic space. Okay, so left lateral canal, although it can't communicate with the supracholic compartment because of the phrenicocholic ligament, it can communicate with the pelvic cavity. Actually it's communicating with the Douglas pouch. Okay, and then here right mesenterial sinus is a limited one. It's a limited one. It's not communicating with any other structure, any other topographical structure, because the small intestine mesentery and all is obstructing the way to the pelvis. Okay, so here I forgot to tell the superior walls of the mesenterial sinuses is the for both it's the transverse colon. Okay, transverse colon, and also its mesocolon. Okay, and here the left mesenterial sinus, it can communicate with the pelvic cavity. It can communicate with the pelvic cavity. Okay, here it's not communicating. It's the limited structure, limited one. So you can see all this from this picture, this note. So that's all for today. Thank you so much for joining with me.